Good morning and welcome to the first day of Maine Healthcare Association's Fall Conference. I think I can speak for our staff at MHCA that we wish we were at the Samoset, and maybe you do too. It's always a good time to be able to meet and greet our members and for us to learn together at the great programs that are part of the Maine Healthcare Association's conferences. But that's not to be for this year. I want to thank Karen for her hard work in putting together this program. And also want to thank Diane for working with our vendors. Things are different this year, but I think you're going to be pleased with the outcome. Technology has brought us such a long way, and I think that you'll be pleased with the product today. So we also know that not everyone has been able to attend Fall Conference. Not everyone can travel to the Samoset. So for those that have not been able to be here in person, we hope you will enjoy the presentations and our keynotes. It's the same conference, but just a different format this time. This has been a difficult year, obviously, for all of us. We know how much has been asked of you, and we want to thank our members for the support they've given Maine Healthcare Association as you've struggled with your own issues and problems. We appreciate the support. We appreciate especially the large number of you who registered for the virtual conference this year. We have exceeded our projections, and we just look forward to being able to give you an excellent product again this year. I also want to express my appreciation to the vendors who stuck with us and have virtual booths this year. I want to ask you to please attend and visit those virtual booths. It's a great opportunity to meet the vendors that can provide you information on their products. It's also a great opportunity to win prizes. Some things have stayed the same as ever. Great prizes, lots of opportunities to win. So please, hope you will visit that section of the conference, and I look forward to meeting the vendors myself and interacting with all of you this year. So thank you for that. We're always proud of our members, and we enjoy representing you. We've never been prouder, though, than this year. Through these difficult times, your reaction and your response has been very heartwarming. We're proud of what you do. COVID-19 was a real punch in the gut for all of us. Probably like me, you can remember seeing the stories that came out of Washington State and thought at the time, there but for the grace of God go I. We knew what to expect, but still when it hit, it was a tough thing to accept. It was tough to take. It was also especially concerning when we first realized how many people would test positive for COVID-19 but be completely asymptomatic. That was a real game changer for all of us. What we have learned since then here and in other states is that COVID-19 outbreaks are not a black eye. It doesn't discriminate. It doesn't just hit bad facilities, it hits good facilities. It hits excellent facilities. It's a real challenge to deal with, and our members are up for it. You already had demanding positions, whatever your role is in the facility, but even more so this year. We appreciate what you do, and we know that others do as well. We need to make sure that that is expressed often to our providers. Your stories inspire us. We have spoken to our members about what's happening in their facilities, and we hear about people. We hear about people like Linda Short. She's a CNA at Pine Point. She's worked there for 20 years. When the outbreak hit at Pine Point, she was the first to step up and say that she wanted to work in the COVID-19 unit. And so for 5 weeks, those were the shifts that she took. She put aside her own concerns about health, and she worked that unit every single shift that she could. She's an inspiration to all of us. There's no doubt about that. Another person we have in mind is Cindy Quinlan, the longtime administrator at Clover. Cindy has been at Clover for 40 years, and I know she's getting ready to retire this year. She picked a tough year to go out. But I know that from talking with other people at Continuum, that she carried more than her share of the burden. She worked extra hours, she helped out on shifts. She hand-delivered test samples to Augusta on a regular basis when they were going through multiple days of testing. At the end of the day, she would deliver them. I know she was an inspiration to others at her facility, and there are many more like her that have done the same. We're very proud. Overall, I think we have to say that Maine has managed the pandemic far better than many states. I talk to my counterparts, I hear what's going on elsewhere. Maine has managed this situation well. We don't get enough credit for that, I don't think. You don't get enough appreciation, but we want to make sure that we know what you're doing, we know how difficult it is, and we're proud of the success that you have achieved. Pressure is certainly mounting now to reopen facilities. That will present a new challenge, and reopening is a positive thing. We all look forward to it. We want to get back to normal as soon as we possibly can. We also know you need to protect your residents, and Maine Healthcare Association will do everything that it can to help you deal with those issues. We know that there's a continuing need for PPE, there's a need for more testing, and that you need to be able to pay your dedicated staff. These are the things that we advocate for. Moving ahead, those needs will still continue, and now vaccines are coming soon. We've been contacted by the governor's office this week to talk to them about Maine's vaccine policy. There is no question that nursing homes and assisted living facilities have been at the forefront of the fight against COVID-19. We need to continue to be a priority. When COVID-19 first reared its head, I think people were mostly concerned what will happen with the surge in the hospitals. It didn't really work that way. We ended up being at the forefront, and I think we all had to work hard to make certain that resources were shifted to long-term care, because that turned out to be the battleground and still is. I think American Healthcare Association would join me in saying that we wish we could be with you. We're used to being in the facilities. We're used to having our members visit us at Maine Healthcare Association's offices, but that hasn't been possible for the last 6 months. So we're here with you today virtually, and we'll continue to support you that way. Our goal is to continue to provide high levels of support and advocacy, connecting with you to provide support services and supplies, providing regular updates to our members by email, timely education on COVID-19, but also on other issues that we would be dealing with normally, and also educating the public about what you're doing and what's happening in facilities during the outbreaks. I grew up in a small Maine town and certainly understand the importance of community. And when I look around, I see long-term care as a community. I like to think that we are an important part of that community and that we are able to contribute to the community. So we are each other's community is what I'm saying. I hope you'll enjoy the conference this year, and I look forward to seeing you in person next year at the Samoset, and we will all enjoy being back together. But in the meantime, I do have another duty. I need to introduce our keynote speaker for this morning, Lori Porter, CEO, National Association of Healthcare Assistants. Lori started her career in long-term care 40 years ago. She began as a dietary aide, served as a CNA for 7 years, was a nursing home administrator for nearly 7 years and operations director of 10 skilled facilities in the Midwest. In 1995, she created the National Association of Healthcare Assistants, NAHCA. Her mission is, 1, to honor and recognize CNAs and frontline caregivers who serve our elderly and disabled residents, and 2, elevate their profession through professional development, advocacy, and empowerment. She is a nationally sought-after speaker and the author of Everything I Learned in Life, I Learned in Long-Term Care. Here at Maine Healthcare Association, we get to preview snippets from the speakers that we're considering for fall conference. The staff really, really enjoyed her presentation. We were looking forward to having her with us in person. We were thrilled that she and our other keynotes were able to stick with us. And so I know you will enjoy hearing her today. Please join me in welcoming Lori. Thank you.